Every insight deserves an audience. Welcome to Atypica AI. The numbers are staggering. Ultra-processed foods now make up over 60% of what children eat daily. That bag of chips, those chicken nuggets, that breakfast cereal, they're not just convenient food choices. They're products designed to hijack your brain's reward system and keep you coming back for more. After analyzing dozens of scientific studies, interviewing healthcare professionals, policy experts, and real consumers struggling with these choices daily, I've reached an unavoidable conclusion. We're living through a manufactured health crisis, and the companies profiting from it have no intention of stopping. Today, I'm going to show you exactly how this system works, why individual willpower isn't enough to beat it, and what must happen to break the cycle that's making millions of people sick and poor. Let me start with what triggered this investigation. I kept seeing the same pattern everywhere. People making what seemed like obviously unhealthy food choices, then blaming themselves when they got sick. But when you dig into the research, you realize this isn't about personal responsibility. It's about a system specifically designed to make the unhealthy choice the easiest choice. The evidence is overwhelming. Recent systematic reviews show that for every additional 100 grams of ultra-processed foods you eat daily, that's about one small bag of chips, your risk of hypertension increases by 15% and all-cause mortality by 3%.
Children consuming these foods at current rates face a 23% higher risk of developing obesity. This isn't correlation-controlled trials. Prove that people eating the same calories and nutrients lose more weight when those calories come from whole foods instead of processed ones. But here's what the studies don't capture: the human cost. I spoke with Maya, a single mother working 2 jobs. She told me, "When I get home at 8 p.m. with 2 hungry kids, I'm not making quinoa bowls. I'm opening whatever's fastest." Alex, a freelance designer, described the brain fog and energy crashes. "I'd eat these convenience foods, feel terrible, then need more sugar to function. It was a cycle I couldn't break." This isn't happening by accident. These products are what I call engineered addiction. Food companies employ teams of scientists to create the perfect combination of salt, sugar, fat, and chemical additives that trigger your brain's reward pathways while bypassing natural satiety signals. They've weaponized food science against your biology. Now, you might think, but I can just choose to eat better. Here's why that's nearly impossible for most people. The system operates through 3 interconnected cycles that trap consumers. First is what I call the corporate profit engine. Higher sales mean higher profits, which fund more marketing and better product engineering for addiction. That marketing creates false desirability, making processed junk seem normal, convenient, even healthy through health washing claims. This drives more consumption, generating more profit, a self-perpetuating machine designed to grow consumption indefinitely. Second is the social inequity cycle. If you're low income, stressed, or live in a food desert, ultra-processed foods aren't just convenient, they're often your only viable option. A bag of apples costs more than a bag of chips. Fresh food spoils. Processed food lasts months. When you're working multiple jobs with no car, you buy what's cheap and available. But consuming these foods leads to worse health outcomes, medical debt, reduced productivity, and deeper poverty. The system traps the most vulnerable in a cycle of poor health and economic hardship. Third is the physiological dependency cycle. Ultra-processed foods disrupt your gut bacteria, trigger systemic inflammation, and override your body's natural hunger signals.
Your biology literally changes to crave more of what's making you sick. When you're metabolic damaged and constantly tired, preparing fresh food becomes even harder, pushing you further toward processed convenience. I know some of you are thinking, what about government regulation? Isn't someone protecting us? That's the most frustrating part. There is a weak counterforce, public health advocates pushing for better policies, but it's massively outgunned by industry lobbying. Food companies spend millions fighting every proposed regulations, funding fake research, and capturing regulatory agencies. As one consumer advocate told me, expecting them to self-regulate is naive and unrealistic. But here's what gives me hope. We know exactly what works. Countries that have implemented strong policies are seeing dramatic results. Chile introduced octagonal warning labels on ultra-processed foods, simple black stop signs that say high in sugar or high in sodium. Sugary beverage Voters dropped 24% immediately. Mexico's similar system is projected to prevent 1.3 million obesity cases. Brazil's trials show these labels help people make healthier choices in seconds, not minutes. The solution isn't complicated, but it requires acknowledging a hard truth. This isn't about personal choice in a fair marketplace. This is about a rigged system that needs to be re-engineered.
Here's what must happen. First, mandatory warning labels on all ultra-processed foods.
Not voluntary guidelines, mandatory. These labels should be based on processing level, not just individual nutrients. When people can instantly identify engineered products, consumption drops significantly. Second, severe restrictions on marketing, especially to children. You can't advertise tobacco to kids, and you shouldn't be able to advertise addictive junk food to them either. Chile had cartoon characters on unhealthy food packaging and restricted TV advertising during children's programming.
It works.
Third, we need fiscal policies that make healthy food cheaper and processed food more expensive. Tax ultra-processed products based on their level of industrial processing, then use that revenue to subsidize fresh fruits and vegetables, particularly in food deserts. I've already started applying these insights in my own life. I now read ingredient lists, not just nutrition labels. If I can't pronounce half the ingredients, it goes back on the shelf. I shop the perimeter of the grocery store first, where whole foods live. Most importantly, I've stopped blaming individuals for choices made in a rigged system. If you're struggling with food choices, understand this. It's not your fault, but it is your responsibility to navigate the system differently now that you know how it works. Start reading those ingredient lists. Support policies that prioritize health over corporate profits. And remember, when you choose real food over engineered products, you're not just improving your health, you're withdrawing your support from a system designed to keep you sick and dependent. The companies engineering this crisis are counting on you to keep buying what they're selling. The question is, will you?
Want to learn more about interesting research?
Check out
Atypica AI.